This is Professor Capron. Welcome to our presentation on atrial flutter. Let's take a look at the learning objectives for this presentation. By the end of this presentation, you will understand the identification and characteristics of atrial flutter on an ECG. You will comprehend the physiological mechanisms behind atrial flutter, assess and recognize the clinical presentation of atrial flutter, know the medical and nursing management strategies for patients with atrial flutter, and identify related conditions that can lead to or result from atrial flutter. These are the key terms for this presentation. Please make sure that you understand each of them. If you still don't understand them at the end of this presentation, please come and find me in class so we can get it straightened out. Let's take a look at the ECG characteristics of atrial flutter. Atrial flutter is characterized by a distinctive sawtooth pattern of P waves on an ECG. This pattern results from rapid atrial contractions. These are known as flutter waves, and they occur at a rate of 250 to 300 beats per minute. The sawtooth appearance is most easily seen in leads 2, 3, and AVF on the ECG. Recognizing this pattern is crucial for diagnosing atrial flutter, as it is unique to this arrhythmia. In atrial flutter, the AV node acts as a gatekeeper, blocking some of the rapid atrial impulses to protect the ventricles from beating too fast. This results in multiple P waves before each QRS complex. Common ratios are 2-to-1, 3-to-1, or 4-to-1, meaning for every 2, 3, or 4 P waves, there is one QRS complex. The ratio can vary, and this variability can sometimes make diagnosis challenging. The ventricular response in atrial flutter can be regular or irregular. When the conduction ratio is constant, for example, 2-to-1 or 3-to-1, the ventricular response is regular. However, if the AV node's conduction ratio varies, the ventricular response becomes irregular. This variability can influence how the patient presents clinically, with symptoms ranging from mild palpitations to more severe hemodynamic instability. Despite the rapid atrial activity, QRS complexes in atrial flutter are typically normal in duration, measuring between 0.06 and 0.12 seconds. This is because atrial flutter primarily affects the atria and the AV node, without directly altering the ventricular conduction pathways. If the QRS duration is prolonged, it could indicate the presence of an additional conduction abnormality, bundle branch block, or ventricular hypertrophy. Now let's look at the physiology of atrial flutter. Atrial flutter originates from irritable cells in the atria. These cells are hyperactive and generate electrical impulses at an abnormally rapid rate, typically between 250 and 300 beats per minute. This rapid firing disrupts the normal rhythm of the heart, leading to the characteristic sawtooth pattern observed on the ECG. The irritable cells create a re-entrant circuit, a self-perpetuating loop of electrical activity within the atria. This re-entrant circuit is what sustains the rapid atrial rate. Understanding the source of these impulses helps in targeting treatments, such as antiarrhythmics or ablation therapy, to control or eliminate the re-entrant circuit. The AV node serves as a critical gatekeeper in the heart's conduction system. In atrial flutter, the AV node cannot conduct all the rapid atrial impulses to the ventricles. If it did, the ventricles would beat excessively fast, potentially leading to severe hemodynamic compromise. Instead, the AV node selectively blocks some of these impulses. This protective mechanism ensures that not all the atrial impulses reach the ventricles, thereby preventing excessive ventricular rates. The AV node usually allows a controlled number of impulses to pass through, resulting in a ventricular rate that is a fraction of the atrial rate, commonly seen as 2-to-1, 3-to-1, or 4-to-1 conduction ratios. This selective conduction helps to maintain more stable ventricular function, even when the atrial rate is extremely high. The rapid atrial contractions and the AV node's selective blocking of impulses creates the distinctive sawtooth pattern on the ECG. This pattern is composed of multiple, evenly spaced P waves between each QR complex. The sawtooth waves, or flutter waves, are best observed in the inferior leads, 2, 3, and AVF. and sometimes in the V1 lead. The consistency of these waves occurring at a high rate is a hallmark of atrial flutter and distinguishes it from other arrhythmias, such as atrial fibrillation, which presents with a more chaotic atrial activity. Recognizing this pattern is crucial for diagnosis and subsequent management of the condition. The rapid and regular atrial contractions in atrial flutter can lead to several clinical implications. The reduced efficiency of atrial contraction can decrease overall cardiac output, especially if the ventricular rate is also high and irregular. This can lead to symptoms such as palpitations, dizziness, chest pain, and in severe cases, syncope. Additionally, the turbulent blood flow in the atria can increase the risk of thrombus formation, leading to a higher risk of stroke or systemic embolism. Therefore, understanding the physiology behind atrial flutter not only aids in accurate diagnosis, but also underscores the importance of timely and effective treatment to prevent complications. Let's take a look at how we assess patients with atrial flutter. Patients with atrial flutter often present with palpitations, a sensation of the heart racing or pounding. This is due to the rapid atrial rate and the irregular ventricular response. Chest pain can also occur, especially if the rapid heart rate leads to increased oxygen demand and decreased supply to the heart muscle. Dizziness or lightheadedness is another common symptom, resulting from decreased cardiac output and reduced blood flow to the brain. Patients may describe a rapid, fluttering sensation in their chest, often perceived as irregular or racing. Chest pain may be present if myocardial oxygen demand exceeds supply, particularly in patients with underlying coronary artery disease. Dizziness results from compromised cardiac output, leading to decreased cerebral perfusion. Atrial flutter increases the risk of thromboembolism. The rapid and ineffective contractions of the atria lead to stasis of blood, particularly in the left atrial appendage. This stasis can result in thrombus or a clot. If a thrombus dislodges, it can travel through the bloodstream and cause an embolic event, such as a stroke or systemic embolism. Blood stasis in the atria promotes clot formation, increasing the risk of embolic events. A significant concern is a stroke. Anticoagulation therapy may be required to mitigate this risk. Assessing the hemodynamic status of a patient with atrial flutter is crucial. Regular monitoring of blood pressure and pulse helps to evaluate the stability of the patient. A rapid ventricular response can lead to hypotension and signs of poor perfusion, such as cool extremities, altered mental status, or decreased urine output. Monitor for signs of hypotension, which can indicate poor cardiac output and perfusion. Assess for irregularity and rate of pulse. A high ventricular rate can lead to hemodynamic instability. Look for signs of adequate perfusion, such as warm extremities, normal mentation, and stable urine output. Continuous ECG monitoring is essential for diagnosing and managing atrial flutter. The characteristic sawtooth pattern of flutter waves and the regular or irregular ventricular response must be identified. Regular ECG checks help to monitor the effectiveness of treatment and detect any changes in rhythm or rate. Continuous monitoring provides real-time data on heart rhythm, which is essential for immediate intervention if necessary. Make sure that we're recognizing atrial flutter early because this allows for prompt intervention to manage symptoms and prevent complications. Interventions may include rate control with medications like beta blockers or calcium channel blockers, rhythm control with antiarrhythmics, and anticoagulation to prevent thromboembolism. Hemodynamic stability is a priority, and significant symptoms or instability may require urgent cardioversion. Medications that we tend to use are beta blockers and calcium channel blockers to control heart rate, and antiarrhythmics to restore normal rhythm. To prevent thromboembolism, particularly in patients at high risk for stroke, we will use an anticoagulant. And cardioversion may be necessary for patients with severe symptoms or hemodynamic instability to restore normal sinus rhythm. Let's look more closely at the medical management of atrial flutter. Antiarrhythmic medications are used to control the heart rate and rhythm in patients with atrial flutter. These medications work by modifying the electrical impulses in the heart to promote a more regular rhythm and prevent the rapid, irregular contractions characteristic of atrial flutter. Antiarrhythmics can alter the flow of ions across cardiac cell membranes. This stabilizes the cardiac electrical activity. Examples are things like amiodarone, flecainide, and sotalol. These are common antiarrhythmics used for atrial flutter. If you do not have a med card for amiodarone, flecainide, and sotalol, please make sure that you get one done. These medications help to restore a normal rhythm and reduce symptoms such as palpitations and dizziness. Beta blockers are commonly prescribed to slow the heart rate in patients with atrial flutter. By blocking the effects of adrenaline on the heart, these medications reduce the heart rate and decrease the workload on the heart. Beta blockers inhibit the action of catecholamines, this is adrenaline and noradrenaline, on the beta adrenergic receptors. This leads to a slower heart rate. Examples are metoprolol, atenolol, and propranolol. And you know what I'm going to say now. Make sure you have med cards. These slow the heart rate and it helps to improve symptoms and can prevent complications such as heart failure. Calcium channel blockers are another class of medications used to manage the heart rate and rhythm in atrial flutter. These drugs work by preventing calcium from entering cardiac cells, and this reduces the contraction and slows the heart rate. Calcium channel blockers inhibit the influx of calcium ions during the cardiac action potential, which helps to slow the heart rate and stabilize the rhythm. Examples are diltiazem and verapamil. Make sure you have med cards on them. These medications are particularly useful in patients who cannot tolerate beta blockers or in combination with other therapies. Cardioversion is a procedure used to restore a normal heart rhythm when medications are not effective. It can be performed electrically or chemically. Electrical cardioversion involves delivering a controlled electrical shock to the heart to reset its rhythm. This is typically done under sedation. Chemical cardioversion uses medications like ibuprofen to chemically restore normal rhythm. Cardioversion is often considered when atrial flutter is causing significant symptoms or hemodynamic instability, and when other treatments have not been successful. Given the risk of thromboembolism associated with atrial flutter, anticoagulation therapy is an essential component of management. Anticoagulants help to prevent the formation of clots that can lead to strokes or other embolic events. Anticoagulants inhibit various factors in the clotting cascade, and this reduces the likelihood of clot formation. Examples are things like warfarin, dabigatran, rivaroxaban, and apixaban. So make sure you have cards on those. These medications are crucial in reducing the risk of stroke, particularly in patients with additional risk factors such as hypertension, diabetes, or a history of thromboembolic events. In managing atrial flutter, it's important to tailor treatment to the individual patient's needs and underlying conditions. Regular monitoring and follow up are essential to assess the effectiveness of treatment and make adjustments as necessary. Patients should be educated about their medications, potential side effects, and the importance of adherence to therapy to prevent complications. Regular follow up visits to assess heart rhythm, medication efficacy, and overall health should be scheduled, and patients need to be able to recognize symptoms of arrhythmia and when they need to seek medical attention. Encourage heart healthy lifestyle changes, including diet, exercise, avoiding smoking, and avoiding excessive alcohol consumption. Now let's examine nursing management of atrial flutter. Monitoring the heart rate and rhythm in patients with atrial flutter is critical for early detection of any changes or complications. Regular ECG monitoring can help to track the effectiveness of treatment and identify any need for adjustments. Continuously monitor using telemetry, regular ECG checks, document any irregularities, and report significant changes to the healthcare provider. Regularly assess for symptoms such as palpitations, dizziness, shortness of breath, chest pain, and fatigue. These symptoms may indicate inadequate control of atrial flutter or the development of complications. Continuous monitoring allows for timely interventions and adjustments in treatment, ensuring the patient's heart remains as stable as possible. Patients with atrial flutter are at an increased risk of stroke and thromboembolism due to the potential for blood stasis in the atria, so monitor for any sudden changes in neurological status, such as weakness, numbness, difficulty speaking, or facial drooping. These could be early signs of a stroke. Be alert for symptoms like sudden shortness of breath, chest pain, or unexplained pain or swelling in the limbs, which could indicate a pulmonary embolism or deep vein thrombosis. Early detection of these signs can lead to prompt treatment, potentially reducing the severity of the stroke or thromboembolic event and improving outcomes. Anticoagulation therapy is crucial in preventing the formation of blood clots in patients with atrial flutter. Education on this topic helps to ensure patient adherence and understanding. Explain to them that anticoagulants reduce their risk of stroke by preventing clot formation in the atria. Stress the importance of taking their anticoagulants exactly as prescribed. Missing doses can significantly increase the risk of clot formation. Inform patients about potential side effects of anticoagulants, such as increased bleeding and bruising, and what to do if they experience these symptoms. Educate patients on the necessity of regular blood tests, such as an INR for warfarin, to ensure that the medication is at a therapeutic level. Proper education ensures that patients understand the importance of their medication, and this leads to better adherence and reduced risk of complications. Lifestyle modifications can significantly impact the management of atrial flutter and overall heart health. Providing support and education on these changes is vital. Encourage a heart healthy diet low in sodium and high in fruits, vegetables, and whole grains. Regular physical activity should also be encouraged with a focus on aerobic exercise. Support patients in quitting smoking and reducing alcohol intake, as these can exacerbate atrial flutter and increase the risk of complications. Teach techniques for stress reduction, such as relaxation exercises, meditation, and adequate sleep. Provide tips for remembering to take medications, such as using a pill organizer, setting alarms, or involving family members in their care. Lifestyle modifications can improve cardiac function and reduce the frequency of atrial flutter episodes. Supporting patients in these changes increases the likelihood of long-term success and overall health. Monitoring vital signs is crucial for patients with atrial flutter, as it provides insight into their hemodynamic stability and overall cardiovascular health. So regularly check blood pressure to ensure it remains within a normal range. Both hypotension and hypertension can indicate instability or complications related to atrial flutter. Assess the heart rate for any irregularities. Note if the pulse is consistently rapid, slow, or irregular. This helps in identifying the effectiveness of current treatment and the need for any adjustments. Monitor the respiratory rate to detect any signs of respiratory distress or compensatory mechanisms due to poor cardiac output. A normal respiratory rate suggests stable cardiac function, whereas an elevated rate may indicate underlying issues. Continuous monitoring of these vital signs helps in early detection of hemodynamic instability, allowing for timely interventions to prevent complications. Patients with atrial flutter often present with a variety of due to the rapid and irregular atrial contractions, affecting overall cardiac output and perfusion. Patients may report feeling their heart racing or fluttering in their chest. This is a direct result of the rapid atrial contractions typical of atrial flutter. Ensure that quality, duration, and intensity of any chest pain is noted. This symptom could be indicative of myocardial ischemia or an increase in myocardial oxygen demand. Dizziness can occur due to decreased cerebral perfusion. It's important to monitor and inquire about any episodes of dizziness to prevent falls and other injuries. Persistent fatigue is a common complaint, often resulting from decreased cardiac efficiency and poor perfusion of tissues. Assess the extent and impact on daily activities. Recognizing and addressing these symptoms promptly can improve patient comfort and prevent further complications. Proper symptom management is essential for maintaining quality of life. Evaluating the patient's ability to perform regular activities helps in understanding the impact of atrial flutter on their daily life and overall functional status. Ask the patient about their ability to perform daily tasks, such as walking, climbing stairs, and household chores. Note any limitations or increased effort required for reasons. Inquire about any changes in their exercise routine or ability to engage in physical activities. A decrease in exercise tolerance can indicate worsening cardiac function. Understand how atrial flutter affects the patient's social, recreational, and occupational activities. This provides a comprehensive view of their quality of life and helps in tailoring management plans. Assessing activity levels gives a clear picture of the patient's functional capacity and helps in identifying any deterioration in their condition. This assessment aids in developing appropriate care plans and interventions to enhance their daily functioning. Now let's look at some related conditions and their significance. Heart disease, particularly those affecting the atria, is a significant risk factor for atrial flutter. Conditions like coronary artery disease, congestive heart failure, and valvular heart disease often lead to structural changes in the atria, making them more susceptible to arrhythmias. Coronary artery disease can lead to ischemia and infarction of the atrial tissue, which may result in atrial flutter. The damaged tissue can disrupt the normal electrical pathways, causing rapid atrial contractions. Congestive heart failure, the heart's reduced ability to pump effectively, can cause atrial dilation and increased atrial pressure. These changes can create a substrate for atrial flutter. Diseases affecting the mitral or tricuspid valves can cause increased pressure and volume load on the atria, leading to atrial enlargement and fibrosis, which are conducive to atrial flutter. Understanding the underlying heart disease is crucial for managing flutter effectively. Treatment often involves addressing the root cause to prevent recurrence. Chronic lung diseases, such as chronic obstructive pulmonary disease and pulmonary hypertension, can significantly increase the risk of atrial flutter. These conditions often lead to right atrial pressure and volume overload, promoting atrial arrhythmias. COPD causes hypoxia and hypercapnia, leading to pulmonary vasoconstriction and increased right heart strain. The resultant right atrial enlargement and remodeling predispose to atrial flutter. Elevated pulmonary pressures with pulmonary hypertension increase the workload on the right atrium, causing dilation and stretching of the atrial walls, which can initiate atrial flutter. Managing these chronic lung diseases effectively can reduce the incidence of atrial flutter. This includes optimizing respiratory function and controlling pulmonary pressures. Hyperthyroidism increases the metabolic rate and sympathetic activity, which can result in various atrial arrhythmias, including atrial flutter. Elevated levels of thyroid hormones increase the sensitivity of the heart to adrenergic stimulation, leading to increased heart rate and excitability of the atrial cells. Patients with hyperthyroidism may present with palpitations, tachycardia, and other arrhythmias due to the overstimulation of the heart. So, identifying and treating hyperthyroidism is crucial in patients with atrial flutter. Normalizing thyroid hormone levels can help to stabilize the heart rhythm. Atrial flutter is a common complication following cardiac surgery, particularly surgeries that involve the atrium or any open heart procedures. Manipulation and trauma to the atrial tissue during surgery can disrupt the normal electrical pathways, leading to atrial flutter. Postoperative inflammation and pericarditis can also contribute to the development of atrial arrhythmias. Patients post-cardiac surgery should be closely monitored for arrhythmias. Early detection and management are essential to prevent complications. Awareness of the risk of atrial flutter in post-cardiac surgery patients helps in prompt recognition and intervention and helps to improve patient outcomes. So let's summarize what we've learned in this presentation. We learned how to identify the ECG characteristics of atrial flutter. So, sawtooth pattern is the hallmark of atrial flutter. It's the irregular, multiple P waves that are seen before each QRS complex. There are multiple P waves for every QRS complex, often in a fixed ratio such as 2:1, 3:1, or 4:1. The ventricular rate may be regular or variable depending on the degree of AV block. The QRS complexes are typically normal in duration, measuring between 0.06 to 0.12 seconds. Recognizing these features on an ECG is essential for diagnosing atrial flutter and differentiating it from other atrial arrhythmias, such as atrial fibrillation. Understanding the physiological basis of atrial flutter helps in comprehending why this arrhythmia occurs and how it impacts the heart. Remember that it's caused by irritable atrial cells. Abnormal electrical activity in the atria leads to rapid, repetitive atrial contractions. And often, atrial flutter involves a re-entrant circuit where the electrical impulse continuously circles through the atria, leading to rapid atrial rates of 250 to 300 beats per minute. The AV node serves as a gatekeeper, blocking some of these rapid impulses to protect the ventricles from excessively fast rates. This results in the characteristic P to QRS ratios seen on the ECG. By understanding these mechanisms, we can appreciate why atrial flutter presents with its distinct ECG pattern and why managing the ventricular rate is crucial to prevent complications. We also looked at the clinical significance because atrial flutter is not just an abnormal rhythm. It has significant implications that require careful monitoring and management. Due to the rapid and irregular atrial contractions, blood flow in the atria may become stagnant, increasing the risk of thrombus formation and subsequent embolization. This can lead to strokes or other systemic embolic events. Patients with atrial flutter often experience palpitations, chest pain, dizziness, and fatigue. These symptoms can significantly impact the quality of life and daily functioning. Rapid atrial rates can compromise cardiac output, especially if the ventricular rate becomes too fast or irregular. Monitoring hemodynamic status, including blood pressure and pulse, is essential to ensure stability. And management includes controlling the heart rate, restoring normal rhythm if possible, and preventing thromboembolism. This often involves the use of medications such as beta blockers, calcium channel blockers, antiarrhythmics, and anticoagulants. In some cases, electrical cardioversion or catheter ablation may be necessary to restore and maintain normal sinus rhythm. Thank you so much for paying attention to this presentation. Make sure that you're getting up and getting some movement and not just spending all your time studying. And when you're all done with this, remember to go out and do some nursey things.